That's wonderful. That's one of our favorite spots as post reporters. And of course, looking to get back there once cases go down a bit here in DC. And so, on that point of international cooperation, I mean, certainly we've seen in the US how destructive disinformation can be. What can countries do to better partner to address this issue?
Partnership is really important because I think what we're seeing in terms of tech regulation around the world is in a way a leveling up process. Relations between different parliaments to understand the different approaches being taken in legislation is very helpful in terms of understanding what we can do. The UK, with the online safety bill, will probably be the first country to establish a very broad-based regulatory structure to ensure that what's illegal offline is regulated online and by an independent body. But there are similar approaches being taken in Australia, in the European Union. And I've been very interested to follow closely issues being raised by different members of Congress in America, looking at how Section 230 could be reformed. I discussed with Senator Warner his safe tech bill as well, which has got lots of very interesting ideas in how you create exemptions from Section 230 for some of the most problematic areas. But on disinformation and election interference, it's particularly important because we know there are some common bad actors, state-sponsored organizations that are seeking to interfere in elections around the world and interfere in democracy. They're not even necessarily looking to persuade the world of a counter-narrative, but leave people in a position where they don't know what to believe. Now, I think if you'd had this debate a couple of years ago, it's inevitably seen as quite political, depending on your point of view or the arguments being raised. But I think what the COVID pandemic has demonstrated is just how dangerous disinformation can be in the context of public health, where treatments, bogus treatments, and anti-vaccine conspiracy theories are being promoted, and they can have a real impact on public health. So it's increasingly important that we address these issues.